You know how it goes? You're keen to understand something properly, to really get under the skin of a topic, but sometimes the sheer volume of information out there can feel, well, like climbing a mountain.
Yeah, it can be overwhelming.
Well, that's exactly what we aim to do for you here. Today, we're taking a pretty fascinating journey into the past, diving deep into a book from 1918.
Wow, 1918.
Yeah, Massage and the Original Swedish Movements by Kurre W. Ostrom, and it was revised by P. Silverberg.
Okay, and what's interesting about this particular book, is who it was for. It wasn't really like a general wellness guide or, a quick fix thing.
Right.
This was actually a text written for doctors, medical professionals, and others who were seriously involved in the healing practices back in the early 20th century.
So, proper practitioners.
Exactly. Ostrom and Silverberg, who revised it, they really aim to lay out a clear understanding of the fundamentals, the principles, the practical applications of massage, and what they call the original Swedish movements. Think of it like a detailed manual from a totally different era of therapy.
Absolutely. And even though, yeah, it's over 100 years old, the book is just brimming with insights.
Mm-hmm.
So our mission in this deep dive is basically to pull out the core knowledge from this historical text.
Mhm.
The foundational ideas, the specific techniques they were using,
Yeah.
and how they applied them to help people way back in the early 1900s. It's a chance for us to see how our understanding has, evolved,
For sure.
but maybe also rediscover some valuable stuff from the past.
Oh.
So let's unpack this. Maybe start with the historical roots. Where did this all come from?
Yeah, the book actually kicks off by looking way back at the long history of both massage and therapeutic exercise.
Okay.
It touches on ancient practices,
Yeah.
China, Egypt, Persia, Greece. And what's striking is the understanding, even thousands of years ago, that there's this powerful connection between movement, the flow of blood, energy in the body, and just overall health. The ancient Greeks, for instance, Plato pointed this out. They saw a difference between active movements you do yourself and passive movements done to you. They even had specialists called petrissage who focused on these manual therapies.
The data tribes.
Yeah. It just highlights this really long-standing human intuition about, the benefits of touch and movement for well-being.
That's a great point. This wasn't some sudden invention. And it wasn't just the Greeks, right? The Romans also used these methods.
Oh, yeah, the Romans were big on it too, maybe even expanded on them. But then, as the book notes, things seem to quiet down a bit during the Middle Ages.
Cook a backseat.
Exactly. It wasn't really until the 15th and 16th centuries that physicians started showing renewed interest in what they called therapeutic gymnastics.
Okay, so revival then.
And that renewed interest really picked up steam in the 19th century. Therapeutic gymnastics became more formalized as a discipline.
Right.
But the book makes a really important distinction, between just general exercises and this specific Swedish approach, which they often call the movement treatment.
Okay, what was the difference?
According to Ostrom, the key difference was the focus on carefully estimating the amount of force used in each movement.
Ah, precision.
Exactly.
Ah.
And tailoring it very specifically to an individual's strength, their particular needs, even their tolerance level.
So it wasn't just go do 10 reps of this. It was much more personalized.
Very much so. The book stresses how Swedish movements were designed to be comfortable, adaptable, and based on a solid grasp of anatomy, how the body's built, and physiology, how it works.
Right.
They even contrast this with what they call potentially harmful promiscuous movements.
Promiscuous movements.
Sounds dodgy.
Yeah, it just meant exercises done without that careful anatomical and physiological thought. It sounds like they were really pushing for a much more, thoughtful and informed approach to exercises therapy.
Makes sense.
Exactly. And this brings us neatly to the core of the book, the fundamental principles of massage itself as they saw it.
Ostrom defines massage as a scientific treatment. That's his term. And it involves passive, systematic manipulations performed directly on the skin. He even specifies it should be nude skin for the treatment.
Interesting detail.
Yeah, and what's particularly noteworthy is the credit the book gives to Dr. Mesger.
Mesger.
Yeah, Dr. Mesger and his Swedish students like Bergen and Halliday, they're credited with really establishing massage as a therapy grounded in, scientific principles.
Okay, so what exactly were Mesger's key principles then? What made his approach scientific in their eyes?
Good question. The book lays out about 4 main points.
Sure.
First, it had to have that scientific foundation, right? based on anatomy and physiology.
Got it. No to body.
Second, the specific manipulations weren't just random rubbing. There were certain techniques that had to be learned properly, skilled work.
Okay.
Third, these manipulations were passive. The patient wasn't actively helping or resisting. It was done to them.
Right.
And finally, the application was systematic. It followed a logical order, a method, to affect the body's tissues properly.
Wow. So, yeah, definitely a step up from just a casual back rub.
Absolutely. More involved.
Now, the book dives into a lot of detail on the actual techniques. Can you maybe walk us through some of the main ones they highlight?
Sure. One of the foundational techniques they talk about is effleurage.
Effleurage, that's basically stroking, right?
That's it, stroking. Could be done with the whole hand, just the thumb, even the fingertips. And the main goal here, according to the book, was boosting circulation,
Okay.
specifically in the veins, carrying blood back to the heart, and also the lymphatic system, for fluid balance and waste removal. The idea was to encourage absorption from the tissues.
Got it. So, stroking equals flow. What else?
Next up, they detail friction.
Friction sounds a bit rougher.
Well, it involved using either the whole hand or fingertips again, but definitely with more pressure than stroking.
Okay, and why the extra pressure?
The stated aim was to break down what they called morbid products.
Morbid products, like what?
Things like adhesions,
Yeah.
sticky spots in the tissues, or areas of congestion where fluids might be trapped. Think of it as manually working out knots and restrictions, like really getting in there.
Okay, so friction is for breaking down the tough bits. And then there's petrissage, that's the French word, often means kneading. Yeah.
Precisely. Kneading. Yeah. Petrissage involved applying what they described as a double centripetal pressure.
Double centripetal, meaning?
Essentially squeezing and lifting the muscle or tendon away from the bone or the tissues underneath.
Ah, okay.
The book describes different ways to do it using two thumbs, thumb, and fingers together, even both hands, for bigger muscles. It definitely sounds like a technique aimed at the deeper muscle layers.
Yeah, that sounds like it would really get into muscle tension. And then they also talk about percussion techniques. That sounds even more forceful.
It certainly is. The book details several types. There's hacking, using the edge of the hand, the pinky side.
The karate chop edge?
Sort of, yeah. Then clapping with a flat hand, punctation, which is like tapping with fingertips, and beating with a closed fist.
Wow. Okay,
Yeah.
where did they use all that?
All over, really, but for different reasons. Yeah. Around nerve centers, directly on muscles, even on the head, chest, down the sciatic nerve in the leg.
The head. Beating on the head.
Well, maybe not beating hard, but percussion, yeah. Interestingly, they also specifically warn about using punctation, the fingertip tapping very carefully near the heart.
Good advice.
Definitely. It just gives you a sense of how specific and targeted they intended these techniques to be.
It's quite a toolkit, from gentle stroking to, well, beating. So how did they actually put all this together in a practical therapeutic way?
Right. This is where the book brings in the ideas of introductory, general, and local massage.
Okay.
And they really stress the importance of what they called introductory massage.
Introductory.
The idea was to kind of prepare the drainage systems, the veins and lymphatics, before you go right at the problem area.
Like clearing the pipes first?
Exactly. For example, if someone had, say, synovitis inflammation in the knee joint,
Yeah.
they might start by gently stroking the whole thigh first to help improve fluid drainage from the entire leg.
Makes sense.
Or if someone had headaches they thought were related to poor circulation, they might use a specific neck massage. Hofinger's method was mentioned to encourage better blood flow out of the head before working on the head itself.
That preparatory step seems really logical. Like you said, clear the pipes before you tackle the clogs.
Precisely. And then the book goes on to give loads of specific examples of local massage techniques tailored for different body parts.
Like the leg.
Yeah, for the leg, it would involve stroking, friction on different muscles, foot, lower leg, thigh, and then maybe hacking or clapping, often with the leg elevated, to help blood return to the heart.
Okay.
For the arm, similar stuff, stroking, friction, kneading. But they also included cautions, like not gripping the wrist too tight, which could block circulation.
Oh, interesting.
Yeah, and they pointed out common mistakes, like therapists neglecting the upper arm and shoulder muscles. Shows how much attention they paid to the details for each area.
It's fascinating how granular they get. What about the chest area? What kind of techniques there?
For the chest, they described upward and inward stroking, friction on the pecs, and even a sort of pinching technique for paralysis cases.
Wow.
They also talk about breast massage for what they termed caked breasts, presumably related to breastfeeding issues. They recommended gentle pressure, finger frictions.
Gentle being the key word there, I imagine.
Absolutely. They specifically warned against bruising the delicate tissue. And, get this, they even include a recipe for a cream they believed helped with bust development.
No way. A 1918 bust development cream recipe. That's
Well,
something.
it's those little details, isn't it? Gives you a real glimpse into the time.
Definitely a surprising historical tidbit. What other areas did they cover in such detail? Back, abdomen.
Oh, yeah. Back massage had various stroking methods along the spine. Friction with hands or knuckles, kneading with thumbs, targeting spinal nerves, plus hacking and clapping.
Okay.
They even noted adjusting the speed faster for stimulation, slower for soothing. For the abdomen, relaxation was key, patient often with knees bent.
Right, to soften the belly.
Exactly. And they had very specific illustrated hand movements for stroking and friction. They even recommended self-massage for constipation and discussed enemas for chronic cases. Seems quite thorough for digestive issues.
It really sounds like they tackled a huge range of problems. Did they do massage for internal organs too, like the liver or stomach?
They did. For the liver, they detailed specific techniques, friction with the palm in circles, kneading with the heel of the hand, clapping with varied pressure, even vibrations. And they stressed doing deep breathing alongside it.
Okay.
Stomach massage was mentioned too, though they cautioned that some methods could be dangerous. They gave one example for gastric dilatation, a stretched stomach.
Yeah.
It sounds like something you'd approach very differently today.
Yeah, direct organ massage. Maybe sounds a bit iffy by modern standards. What about the head and face? That's still common today for tension or even cosmetic reasons.
Definitely. They spend a good chunk of time on the head and face. For the head, friction techniques aim to move the scalp, boost blood flow to hair roots. They even mention a specific hair tonic called petrissage.
Petrissage hair tonic. Love it.
Facial massage involved upward strokes. Friction on wrinkles like crow's feet, actually stretching the skin and kneading the cheeks.
Did they think it worked for wrinkles?
They seem to, but they stressed working the underlying muscles, not just the surface skin, to boost circulation. Interestingly, they didn't recommend steaming the face.
Oh, why not?
It doesn't really say, it just notes it wasn't recommended as part of the routine. And for facial paralysis, they describe this really intricate method, a gloved finger inside the mouth, supporting the tissues, while the other hand worked externally.
Wow, that's complex. Requires some serious anatomical knowledge.
Absolutely. Shows the level of detail they aimed for.
What about really specific, delicate areas like eyes, throat, nose?
Yeah, they had approaches for those too.
Mhm.
Eyes involved very gentle eyelid massage, radial or circular motions, light pressure using antiseptics, index finger often placed on the eyebrow for support.
Okay, super gentle.
Throat massage involved stroking the trachea, the windpipe, sometimes with a slight shake. Neck massage had two main methods described: girsts, stroking down from earlobes to shoulder, and hoe fingers, stroking down from under the ears, covering the upper back muscles. Plus general frictions, kneadings, hacking for congestion or headaches linked to neck tension.
Right.
Nose massage was simple, gentle downward stroking with forefingers, also used for scars there. So yeah, specific, gentle approaches for sensitive spots.
It's amazing how comprehensive this book aimed to be. I mean, they even covered massage for the ovaries and uterus. That seems pretty specialized for 1918.
It does, yeah. For ovaries, it was mainly described as stroking. For the uterus, they detailed both external methods like modified abdominal massage for uterine anatomy, lack of muscle tone, and even percussion or beating on the lower back. And they described an internal method too.
Internal uterine massage.
Apparently. Referencing specialists like Ostrom, they talked about gradually increasing pressure, coordinating with breathing, avoiding sudden moves, supporting the uterus. They mentioned other specialists too: Ziegenspek, Brandt.
Wow.
And yes, they even mentioned internal rectal vibrations as a technique sometimes. It really shows the sheer breadth of what they considered within the scope of manual therapy.
Okay, so we've hit a massive range of massage techniques and their applications, body parts, internal conditions, the lot. The book also has a section on pressing and shaking, which sounds like what we'd call vibrations today.
Exactly right. Vibrations. They describe them as oscillatory back and forth movements, applied to arms and legs, but also internal organs.
How did they do it?
They distinguish between digital vibration, using fingers for rapid small movements, and palmar vibration, using the palm. For digital, they stressed a vertical motion, not too much hand bending, to avoid excess pressure.
And where did they apply these vibrations?
All over the place. Forearm, whole arm, sometimes with two operators.
Two people vibrating one arm.
Apparently. Also the leg, liver noting hand position, might need changing their spleen, solar plexus.
Solar plexus, how?
Fingertips just below the breastbone, backward and upward shaking motion, even a standing version for the operator. Also the bladder, gentle pressure, quick vibrations, larynx, eyes holding lids, steady pharynx, thorax, head, heart, abdomen. They specifically mention the descending colon and sigmoid flexure for digestive stuff.
It sounds like they use vibration everywhere. What was the goal? What did they think it did?
The book states these movements have a stimulating and strengthening effect on nerves, and they thought it significantly influenced circulation, both venous blood and lymph, basically invigorating tissues, improving function. They even referenced another book by Kellgren for more detail on vibration techniques.
Okay, so after all these specific techniques for massage and vibration, the book shifts to more general advice for giving treatments.
Yes, exactly. They emphasize starting with moderate pressure, always getting feedback from the patient.
Good advice.
Yeah, and cautioning beginners against using too much force. They also strongly recommend using oily substances, oleaginous substances, they call them.
Like oils or lotions?
Yep. White Vaseline, lanolin, olive oil were mentioned. Helps the hands glide, prevents skin irritation. Interestingly, they warned against glycerin, saying it could irritate some people.
Oh.
And they noted that in America, coconut oil and cocoa butter were sometimes used.
And like any treatment, I assume there were times when massage wasn't recommended, contraindications.
Absolutely. The book lists several. Broken or severely irritated skin is a big one. Wounds, burns, infections like erysipelas, eczema, acne.
Makes sense. Don't rub an open wound.
Right. Also caution with certain blood vessel or lymphatic issues, especially in the elderly. Tumors, infections with pus, risk of spreading things.
Yeah, definitely don't want to spread infection.
Acute bone problems, severe diseases needing complete rest, and pregnancy, especially abdominal massage, were also listed. They even suggested stopping general massage during menstruation and avoiding abdominal work unless specifically ordered by a doctor due to a theoretical risk of hemorrhage. Seems like pretty sensible advice overall.
It does sound like prudent advice, yeah. Now, the other big part of the book's title is Swedish Movements. How did they define those?
They define Swedish movements as a systematic series of therapeutic exercises applied in a very specific, controlled way.
Systematic and controlled.
Yeah. They quote P.H. Ling, a key Swedish figure from the early 19th century, considered a pioneer. Ling defined a movement as every exercise, the direction and the duration of which are fixed.
Okay, so precise instructions.
Exactly. He's credited with setting up the first scientific system for these movements, classifying and standardizing exercises for specific therapeutic goals. Much more structured than just general PE.
So structured therapeutic exercise. How did they categorize the different types of movements in this system?
They broadly divided them into 4 main types, based on how much the patient participated. First, passive movements.
Operator does all the work.
Right. Operator, maybe a machine, or even gravity, move you. No effort from you. Second, active movements exercises you do entirely yourself.
Okay.
Then, concentric movements, also called active-passive. You start the move, but the operator resists you, making it harder.
Like resistance training.
Sort of. And finally, eccentric or passive active movements. An external force moves you, but you actively resist that movement.
Ah, resisting being moved.
Yeah. The key difference between concentric and eccentric is whether your muscles are shortening or lengthening while under tension.
That's a clear breakdown based on effort and resistance. The book then lists a huge number of specific Swedish movements, doesn't it? Looks incredibly detailed.
It is. Super meticulous. Describes a wide range, often includes patient position, operator actions, reps, the intended purpose, and whether it's active or passive.
Give us some examples.
Okay, lots of rotations.
Yeah.
Feet, ankle, lower leg, arms, shoulder, hand, head, whole body at the waist, pelvis.
Rotations everywhere.
Pretty much. Also flexion and extension, bending and straightening for the foot, leg, arms, arm at shoulder, hand at wrist.
Okay, bending and straightening.
Yep. Then separating and closing movements for arms, legs, knees, moving them away from and towards the body's midline.
Abduction and adduction, basically.
You got it. Also various bending movements. Head forward, backward, and sideways, body sideways, forward, backward at the waist, trunk up, down,
Yeah.
bending the knee or both knees.
So it's like a full body therapeutic workout plan, but every move has a specific goal.
Any other?
The types?
Oh, yeah. Raising movements like lifting the head or the whole body, pulling movements, pulling the leg back, pulling the body back, more turning movements, foot in out, lower leg, arm in out, head side to side, turning the pelvis, and finally, depression and elevation of the arms, moving them down and up.
Wow.
The book even says they left out some of the less practical ones from Ling's original system. Gives you a real feel for how comprehensive this approach was meant to be.
Truly sounds like a massive system aimed at fixing a lot of physical issues through very specific prescribed movements. After listing all these, the book talks about the physiology of the movement treatment, right? The why behind it all.
Yes, and they emphasize that the principles are pretty simple, based on what they saw as natural laws of the body,
Like what?
like the basic importance of motion and activity for humans. They talk about the law of metamorphosis, the constant replacement of cells, and things like combustion and excretion as key signs of the body's metabolic activity.
They also mention the downsides of being sedentary, which is still a huge topic today.
Absolutely. They point out how lack of activity leads to imbalances, even overtaxing certain muscles. They use writer's cramp in Clerks as an example.
Ah, the original RSI.
Kind of. And they argue that even just walking, while good, isn't as effective as these systematic movements, because walking might not hit all muscles equally, and it can become automatic, less mindful.
That's an interesting take on walking becoming subconscious. What about the body's chemistry during exercise? How did they view that back then?
They explain that exertion produces carbonic acid and other byproducts causing fatigue.
Lactic acid buildup, basically.
Similar idea, yeah.
Yeah.
They believed blood and lymph remove these. They also describe muscles using up tissue during work, needing replenishment via increased blood flow.
Makes sense.
And they detailed lymph-carrying digested food and the need for oxygen from the lungs. Proper exercise, they said, deepens breathing, increases lung capacity, benefiting circulation through better oxygenation. They even mentioned the body regulating heat during exercise.
And mechanically, how did the movements affect the body's structure?
They explained that contracting muscles condense, pressing on nearby veins and lymph vessels, which they thought helped push fluids back towards the heart.
Okay, a pumping action.
Yeah. They also discussed exercise benefiting joints via nutrition and bones getting stronger where muscles attach due to the repeated pulling. Finally, they stressed the link between the nervous system and muscles, saying these movements could address things like spasms, and noting rapid improvement in central nervous system irritation with certain duplicated active movements. It's a very interconnected view of how movement impacts the whole body.
So this combination of massage and specific movements was seen as a really potent therapy for a huge range of conditions. The book then goes into applying these methods to specific diseases, right?
Yes, a big section on applications. The general idea is that it's an invigorating approach, especially for chronic weakness, whether that's body-wide or just in one part.
But with caveats, I assume?
Immediately. They stress these are general guidelines. The operator must consider the individual, their constitution, the specifics of their illness. What helps one might harm another.
So individualization was key.
Absolutely. Monitoring tolerance, adjusting treatment, crucial. They really underscore that, even within this system.
They start with things like general weakness and anemia. What was the plan for those?
For general weakness, general massage, passive movements, flex, extend, rotate, press the limbs, maybe percussion if they were strong enough.
Okay.
For anemia, they detailed a specific series of movements from Professor Hartelius of Stockholm.
Hartelius series.
Yeah. Each move was chosen for a reason, targeting respiration for oxygen, circulation for blood flow, digestion for nutrient absorption. A very targeted routine aiming to fix the physiological issues of anemia.
What about conditions like hysteria and insomnia? Common diagnoses then, though we see them differently now.
For hysteria, treatment was mainly general massage, plus a few rotary movements of the arms and legs. The idea was to affect the peripheral nerves.
Okay.
For insomnia, they suggested doing general active Swedish movements near bedtime. They listed specific manipulations and movements thought to promote sleep by influencing the nervous systems involved in sleep-wake cycles. Shows they saw a mind-body connection via physical activity.
And headaches, still a massive issue for people. What did this 1918 book suggest?
The author claims exceptional results for what they call peripheral headaches, probably tension headaches using neck and head massage.
Okay.
They mentioned Dr. Gustav Nordstrom identifying myasthenic deposits, basically knots or tight muscle bands in the neck, as a cause.
Ah, trigger points.
Sounds like it, yeah. The technique involved strong stroking, deep friction, and kneading right on these lumps. Rest afterwards was important.
Right.
They also suggested Swedish movements involving head and body bending. And interestingly, they noted links between headaches and things like gout, rheumatism, or a congested liver, stressing the need to look at diet and medication too. A more holistic view, looking for underlying factors.
Fascinating how they connected dots like that. What about really serious neurological stuff like apoplexy stroke, basically?
They believe that even in old paralysis cases from stroke, their mechanotherapy massage and movement could still help
Yeah.
by stimulating nerves and boosting nutrition to paralyzed muscles via massage, also addressing muscle contractions that opposed movement using exercises and sometimes braces. They give examples for right-side paralysis and usually advise waiting about 3 weeks post-stroke before starting massage. They also mention paralysis from accidents, gout, rheumatism, even lead poisoning, stressing the therapist needed good anatomy knowledge.
And infantile paralysis. Polio, a huge fear back then.
The book sounds quite optimistic here, reporting great victories with scientific massage for polio.
Really? What did they do?
They used electric current to identify affected muscles, usually a month after onset, then initially stroking the whole limb for general nutrition,
Okay.
followed by deeper massage only on the most affected muscles, being careful not to overwork stronger ones. They share a case study showing success with this.
Sounds intensive.
It was. They also mentioned spinal stretching or suspension, coordination exercises like Frankel's, braces, and combining it all with medical, electrical, and hydrotherapy. Daily treatment, careful records. They even noted seashore air might be beneficial.
Wow, a full-on rehab program. What about other nerve issues like TABE, spinal cord degeneration, and neuralgia, nerve pain?
For TABES, or locomotor ataxia, back and abdomen massage with pressing and shaking of limbs, leg extension pulling, gentle beating on the sacrum.
Gentle beating. Okay.
He was using refreshing, invigorating moves, avoiding overexertion. Bed rest with massage and ointments helped, especially leg pulling for the characteristic pains.
And neuralgia.
Peripheral nerve issues responded well, they said. Sciatica example. Stroking, percussion beating along the nerve, leg flex extend, leg raising, sacrum leg beating, even nerve stretching.
Nerve stretching. Ouch.
Sounds like it. For rheumatic neuralgia, like trigeminal neuralgia, they use punctation, kneading, stroking gently at first if tender. Caution for neuritis, nerve inflammation. No deep pressure on the nerve, just gentle stroking nearby to ease blood tension, plus specific movements for recovery.
They even tackle splanchnic neurasthenia? Sounds like maybe IBS or a functional gut disorder?
Yeah, symptoms like abdominal sensitivity, tender enlarged liver, gas. They blamed blood congestion in abdominal veins, losing elasticity.
So what was the fix?
Liver massage first, to improve venous outflow. Then attention to splanchnic nerves, general abdominal and neck massage. Plus, Swedish movements to compress organs and tone the abdomen. They also mentioned electricity, hot-cold therapies, and even referenced a book called The Blues, hinting at a psychological link.
Interesting. Moving to the lungs' affections of the respiratory organs, what was the approach there?
Pretty mechanical view. They thought increasing lung capacity solved many issues. So movements to strengthen weak respiratory muscles, fix chest deformities, promote deeper breathing for better oxygenation.
Makes sense.
For lung catarrh inflammation with mucus, they used hacking, clapping, shaking on the chest to help cough stuff up. Also general movements for muscle activity, skin secretion, believing improved digestion also helped the lungs indirectly.
And throat issues like pharyngitis, laryngitis.
Neck and throat massage to drain congested blood vessels. They claim to see inflamed membranes improve and related headaches, dizziness ease up. Believe massage also acted on tonsils glands to help expectoration.
And finally, a big one. Diseases of the heart. That needs caution. What do they recommend?
They indicated it for heart issues linked to nervous stability, anemia, stomach problems. Recommendations included movements for strong breathing, extremity rotation to help the heart pump, body rotation turning for venous circulation,
Okay.
centripetal stroking for fluid buildup. They mentioned prominent doctors recommending movements to support the heart by boosting distal circulation.
Yeah.
They also discussed the Schatz-Noheim system, mineral baths, resistive exercises based on Swedish movements, gentle massage prep, listed specific duplicated active moves from that system.
What about local heart treatment?
Chest massage, light hacking over the heart area, palmar vibrations on the chest. They noted that vibrations over the heart were sometimes used in Europe, often with machines, but cautioned against it unless prescribed.
Sensible caution.
Definitely. Always ended heart treatments with gentle breathing moves and a mandatory hour of rest. Clearly approached with care, often integrating with other medical practices.
It's really quite something, seeing how they applied these hands-on therapies across such a massive range of conditions. The book keeps going, doesn't it? Digestive diseases, diabetes, uterine issues, rheumatism, even foot deformities, eye and ear problems.
It really does. It's incredibly comprehensive for its time.
Yeah.
For digestive organs, often linked to circulation issues, they had various stomach massage methods. Habitual constipation got massage and movement, starting locally, then going broader, even illustrated home exercises and techniques for infants.
Infants too.
Yep. Hemorrhoids were tackled with abdominal work, body rotations for venous flow, sacrum beating for rectal circulation, obesity, firm massage, and specific Swedish movements, boosting oxygenation to burn fat.
What about diabetes?
Some reported success with mechanotherapy. Theory was strong exercise, improved oxygenation, maybe fixing a liver issue causing sugar buildup, uterine issues, direct massage for atony dislocations, movements for menstrual problems, general massage around the area first, then local work on muscles joints, finishing with circulatory respiratory movements. Operator needed to feel for those rheumatic deposits. Lumbago, stiff neck, similar approach. Massage, pressing, shaking, gentle movements. Gout. Massage seen as preventative, improving circulation, eliminating urates. Spinal curvature, scoliosis, got a lot of attention movements to strengthen weak side muscles, combined with massage.
Sprains, dislocate.
Gentle introductory massage for swelling, gradually increasing intensity, adding movement. Strong critique of prolonged immobilization, varicose veins, limb elevation, gentle stroking around affected veins, not directly on them.
Even fractures.
Discussed in context of early mobilization ideas. Massage around the fracture to reduce swelling. Foot deformities like clubfoot, pigeon toes, flatfoot-specific massage and movement protocols. Eye and ear conditions also got mentions, often involving neck massage to improve circulation or direct, gentle local massage. It's like a whole system of manual medicine.
It truly sounds like it. Towards the end, there are some general remarks, and that section you mentioned on the massage treatment in America, what do they say there?
In general remarks, difficulty fixing treatment times, Misger likes short, effective sessions. Others use longer rest-cure approaches. Massage adaptable even for the very weak. Big emphasis on regulation by doctors. Physician's order was key, and students should get massage to learn proper pressure.
Good points. And the America section sounds critical.
Very critical. Author worried about the abuse of massage in the U.S. due to lack of registration laws.
Abuse how?
Shared anecdotes of visiting American masseurs, perceived lack of science, ignoring sensitive nerves, not using oil causing inflammation, questionable knowledge claims like magnetism.
Oh dear.
Recounted a patient injured by improper force joint flexion by an untrained masseur. Ends with a strong plea for proper regulation, exams, registration to protect the public and the profession. Didn't want it relegated to the wash tub or in the kitchen, as they put it.
Wow, strong words. Highlights concerns about quality and safety even back then in a growing field.
Definitely. Shows that concern about untrained practitioners isn't new. The book finishes with a bibliography, lifting English books on mechanotherapeutics for further reading.
A reading list from 1918.
Yeah, resources for anyone wanting to dig deeper into the science and application as understood then.
Well, this deep dive into massage and the original Swedish movements has been truly fascinating, really eye-opening for me. It's incredible the breadth and depth of knowledge, that systematic approach they had over a century ago.
Absolutely. And I think the key takeaways for you, our listener, are those underlying scientific principles as they saw them, the huge variety of techniques for both massage and exercise.
Yeah.
There's strong emphasis on individualizing treatment, the need for caution, and just that rich historical context shaping it all.
It really makes you think, doesn't it? I mean, considering all that detail from a century-old text, what bits might still be relevant? Or offer surprising insights we've maybe overlooked in modern wellness?
That's a great question.
And the author's concerns about qualified practitioners, that definitely still resonates today, right?
For sure. This whole exploration really invites you to consider the long history here and the potential benefits we might still learn from these foundational practices. Maybe checking out some of those bibliography resources could be a pretty interesting next step.
A truly thought-provoking point to end on. Thanks so much for joining me for this deep dive. It's been great.
My pleasure. Fascinating stuff.
Until our next exploration, everyone, keep that curiosity alive.